We're number 3.
We are here now. Yay!
Yes, I mean, it's really critical. Multidisciplinarity is actually and intersectorality actually is the main common thread through all of the steps that we've outlined for infodemic management processes at the health authority level and with partners. So we've now spent 2 sessions talking about interventions, both programmatic and communication and other types that you saw at the last session, and really thinking about how you design them, how you implement them, and a little bit less on how to evaluate them. But Liz and I have a couple of tips for you now in the wrap up. There is one more video that you will receive in LMS for offline viewing that I highly recommend you do watch. It's a colleague from the Canadian Public Health Association who manages the Immunize Canada program that also works with a network of people and a network of organizations that are using different kinds of interventions, from everything from communications through policy and service delivery, etc., to promote vaccine demand. So Liz, what are the key takeaways from the last 2 sessions? Maybe you do the first.
Okay, this will be shocking to everybody here, but guess what? Intervening on the infodemic is complicated because the phenomenon is complex. It's hard. That's why we're here. We really want to be focusing on changing people's behavior to support healthier outcomes. That's what it comes down to. It is not other things. Other things are the precedent before us reaching this. So when we're thinking about communications interventions or health systems interventions, or when we're thinking about different ways of intervening at the societal level or fact-checking networks, these are all things that ultimately what we're hoping to do will impact people's behavior, and that it will nudge them towards making healthier behaviors and decisions, because they're making these decisions at the individual level. We care because it has population level impacts if enough people do it, right? We need as many people as possible to wear masks, to physically distance, to wash their hands, and to get vaccinated. That is the only way we're going to get past this pandemic, is if everybody takes part and does their bit. And so we can do this by developing those interventions that are human-centered and behaviorally informed. Find yourself a social or behavioral scientist. If you do not have one, go find one. They can be really helpful in thinking through how to do this. It's likely that you will need to develop multiple interventions at multiple levels to make an impact. This includes the information environment, health, and individual, health system, individual, and at society levels. So just to say that you probably will need to do more than just one thing. Because this is such a complex system, you really need to consider how are you trying to attack the problem from multiple angles. That is probably the most effective way of addressing the infodemic. It is important, however, to consider as a health authority what your remit is and where you have the most influence over to address the infodemic. I'll give you an example. You know how I mentioned earlier that fact checkers, they need a place on the health authority website to point to say, yes, this is fact checked and here's the link. Well, that's like a pretty basic thing that we should be able to do, is to have up-to-date content on our websites that address the most common questions and concerns that people have. But you would be amazed how infrequently that actually happens. So there's some basic things that it should be within the realm of control of a health authority to do, that we need to be doing on a more regular basis to a higher degree of timeliness and efficiency. But there also are parts of like the larger infodemic map of concepts that we just have significantly less control over, right? We have very little control at the individual level, how people think and feel about a particular health topic. What we have a little bit more of an influence over is how maybe a whole society talks about it, or how a healthcare provider might engage with a patient that has questions. We might not have a huge amount of control about the general information environment when it comes to, for example, social media or technology platforms and their content moderation policies. We can't necessarily tell Facebook to take stuff down. That may, depending on who you are, that might not work very well, or might not work at all. And so just to say that there you have different degrees of control over different parts of the infodemic, depending on where you're situated, whether in a health authority or for a civil society organization, or if you're somewhere else. So focus on the areas where you can have the most impact. That's the bottom line. The science of what works in infodemic management is nascent, and you will need to borrow from other fields to test out new ideas. Fail fast, iterate, and learn. So if you remember nothing from Howard's talk except fail and fail fast, that is the most useful thing to remember. You need to fail quickly and early so that you can iterate and build on. I will never believe an infodemic manager who tells me that they developed the perfect intervention and everything was wonderful and they solved their infodemic. That just doesn't happen in real life. So the only way to solve the infodemic is to fail and to learn and to grow from those experiences. And most importantly, it's really important to watch out for unintended consequences of actions and interventions, short and long term, way beyond the health system. It's hard to predict some of these because unintended consequences are usually also the ones that we don't think about until after the fact. But do take into account what are the potential harms of a particular action that you might take or an intervention, and how might you mitigate those harms. This is where having an ethicist can be really helpful. This is where making sure that if you have a protocol, if you're doing implementation research, that it goes through an IRB process, and that you're looking out to protect people's rights throughout that process if you're collecting data on them. So this is really critical. Tina, is there anything else that you wanted to add on that point?
I just feel because we're working very rapidly and learning from experience, we are actually working with human beings, and I can't underscore enough how important it is, everything that Liz just said about the ethics. It's the practice, cross-checking, and really assessment of the risk to the populations with anything that we do is really, really important. And not just because we want our interventions to work, but because it needs to be really our guiding principle in working on this. So let's move on to the second half of some of the takeaways. And you saw at that last session, Liz talked really well about the behavioral models that can be useful to understand the reasons why people do specific actions. And if you use that to analyze the pain points, the barriers to people's actions, then you can also identify what would be the interventions that will best address those barriers. It's really important to be really systematic in thinking about and looking back at Howard's talk. It's also very important to then make sure that you really think through all of the possible suggested solutions before you settle in and go for a particular intervention, or you decide to investigate and prototype it. You've heard now from several people from different parts of the world on how they've been managing, and this is also, and really partnerships are key. Across very different stakeholders at very different levels. So you've heard from people speaking that are working right in the middle of the community. And you've heard from people that are actually a bit farther up in a coordinating structure, and they travel between, for example, a multiple country coordination, and then helping and supporting and backstopping what the responders in the country or in the community are doing. So partnerships are really important, and to do any type of infodemic management intervention of any type. And of course, it's really a no-brainer. Everything that we do needs to be tailored to specific individual and community needs. No one infodemic intervention will fit all. This is also extremely important. This is the reason why it's also extremely important that you all share your experience back to the community. Sometimes it's really difficult in the midst of all of our jobs and all of our work to actually reflect on our experience and put key messages, key learnings forward and share it. But it's extremely important that not only do you keep learning from what you've tried for your own practice, but that you share back, because no intervention is gonna just be copy pasted from your context, your situation, your work remit into someone else's work remit. So we need to know how to actually transfer interventions into different contexts. Also consider how you'll monitor and evaluate both how you're going to implement the intervention and also what its impact is going to have. But you need to start with planning this right at the beginning. So any metrics that you're going to produce, base them on a model. So based on a model of that will help you determine what would allow you to measure and learn whether the intervention has the desired impact or outcomes or outputs. But whatever model you use a model. And of course, where possible, and Liz and I mentioned this as well, leverage participatory approaches, not only from the point of view of engagement and communication, but participatory approaches are really key in the intervention, both in the ideation, in the design, when you develop it, when you prototype it, when you implement it, and then when you evaluate it. It's these are approaches that will allow you to, as fast as possible, learn, course correct, and know what's working, what's not working, so that you reinforce what is working, and that you drop and move on from things that aren't. Liz, do you have any comments on this?
Nope. Perfectly done.
So let's move to key resources. Would you like to run us through what you and I collected?
Yes. There are so many resources. This is like, oh, so much good stuff. But probably the most helpful, most relevant thing here is TIP, Tailored Immunization Programs, which is a beautiful document from our WHO Euro colleagues that really lays out everything about COM-B and the behavioral wheel and how you might use these tools to diagnose, and then to also create interventions based on those diagnostics. We have kind of the grandbaby version of that, which is our rapid community assessment that we developed at the US CDC. That's also available. Highly recommend it. It's also available. It's in English and in Spanish, and you can take it and tweak it and make it whatever flavor that is most useful to you. There's a series of tools, the HCD toolkit. So Howard is a big fan of it, and a lot of the content of his presentation came from the HCD toolkit. I highly recommend you check it out, download it, use it. There's tons of resources there on how to do human-centered design work in a very light, flexible way, very, very quickly with a lot of sticky notes. So check that out. There's more information there about the behavior change wheel. The Little Jab book, which does a nice job of mapping interventions to different problems as it relates to COVID-19 vaccine uptake. It's a great example of what you can try that are behavioral interventions. And there's pieces in there that might be relevant for an infodemic manager. There's the basic framework, which Howard mentioned, IDEO Design Kit. IDEO is wonderful. They're one of the original progenitors, I think, of human-centered design as it relates to public health. And they have free online training courses as well. So I highly recommend you check that out. BetterValuation.org is a bookmark on my, in my browser. Excellent resources are available there. ParticipatoryMethods.org has some really great participatory methods, both for not just for evaluation, but also for data collection and diagnostics. And then check out Center for Participatory Research. There are also a few readings that Tina found, which are excellent, related to user experience and health. Definitely recommend you read those.
And here's the metrics reflection.
Yeah, so it's too complicated to even try to sum up all the metrics because it entirely depends on the barrier identified, the innovation developed, what population involves, the objective of the intervention, and what time frame the intervention is spanning. So this will depend quite heavily on who, when, where, how, why. However, there are several evaluation methods that are useful to consider no matter what kind of intervention you use. And we actually focused on community-based ones and those related to participatory approaches. So CBPR, community-based participatory research, is kind of like the big mothership version of participatory work. Most significant change is a great way to collect understandings of how something changed over time as it relates to storytelling and narratives, which is great. It's I think way more interesting than focus group discussions or key informed interviews because it's more friendly, I think, to community members and understanding how they have perceived change over time in a health program. Positive deviance, which is this idea that there are bright spots. There are things that are working really well that work above the average. And if you examine those examples, what is it about those particular examples that make them different from the norm, from the standard, from from the median, and what can you learn from those positive deviants. And then of course there are additional participatory research practices out there, and a lot of the links that we had on the previous page highlight some of these evaluation approaches. We don't spend a lot of time talking about evaluation in this training because we only have so much time together, but highly recommend you start thinking about this from the outset. There's no point to doing infodemic management without trying to evaluate what you're doing. This is especially true because your manager will want to know what you're doing and is it working. So what is it that infodemic managers need to know? Social listening is not sufficient.
Because we're at the top of the hour.
Great. We know social listening is not sufficient. You have to intervene. Seek out behavioral scientists. When you're developing behavioral interventions, you need to consider ethics and approval processes. Interventions work best when conducted on multiple levels, and always design around the humans, always design with the humans. Hopefully, if you don't remember anything else, that's what we say. What do your bosses need to know? Help dot connect between all of these parts of the health program. Provide strategic guidance to the most critical short-term needs from a public health perspective and address them quickly. Explain and advocate for introducing and using human-centered approaches, especially in contexts where this is not typically used. And then support adequate financial human resources to do all of these things. This can't be done for free. And different operating environments, just to say, if you're on the bicycle, you might need to work with your partners in context to develop simpler interventions, make an effort, try to evaluate what you're doing, even if it's simple, share your experiences with others, and that's common across all three, and consult with an ethics expert if possible. If you're in the 4x4, use participatory approaches in design and development of interventions, to develop interventions that work at multiple levels, collaborate with behavioral scientists, share your experiences with others, work with an ethics expert, and look out for unintended consequences. And if you're in the luxury vehicle, you should be doing all those things, plus build participatory approaches into the entire design cycle, and really have robust research design and protocols to evaluate your interventions. So hopefully we gave you enough here to be inspired. And if you have any other questions or comments, you know how to reach us. More will be coming soon, and we look forward to seeing you all again later this week.